The next presenter will be Ralph Hawkins, and he's going to be presenting on Lyme disease from the perspective of a general physician in active clinical practice.
Sir William Osler, he's famously known to say, listen to your patient, he's telling you the diagnosis. Well, the stories that we heard last night reflect dismissiveness, clinical arrogance, condescending patient contact, prejudicial treatment, humiliation. Just about brought me to tears then, it's just about bringing me to tears now. You know, the Canadian Medical Association Code of Ethics is something that we should adhere to as physicians. So there are fundamental requirements that the Canadian Code of Ethics oblige us to uphold. I'm going to read to you the first three fundamental responsibilities. This is number 1, 2, and 3 in our Code of Ethics. Number 1, consider first the well-being of your patient. Number 2, practice the profession of medicine in a manner that treats the patient with dignity and as a person worthy of respect. Number 3, provide for appropriate care for your patient, even when cure is no longer possible, including physical comfort and spiritual and psychosocial support. The stories last night did not reflect that. We as the medical community in Canada are failing our patients, and we as senior physicians are teaching our junior physicians this bad behavior. We need to not teach our junior trainees this dismissive, disrespectful behavior, please. Dr. Gregson suggested that we need science and more science. I would add to that, we also need care and compassion and clinical competence, please. So, what should a Canadian framework include? I think we need to include different definitions for epidemiologic surveillance and actual clinical treatment of patients who suffer the effects of Lyme disease. We need support for research. We need the government to fund basic research, scientific research, bench research, clinical research. We need to help patients. We need to maintain an open dialogue. I have great respect for people who have different opinions on this than I do, and I acknowledge that my opinions are in the minority, but I think we need to have a dialogue about the ideas in order to move forward. Thank you.